Welcome viewers to my channel Physio Neelu. I am Dr. Neelu Jain, Bharatiya Janata Party Borivali Vidhan Sabha Secretary. In this video, I would like to speak on healthcare. I have already made 5 videos on Garib Kalyan, Susashan and Seva, the 9.5 years of Narendra Modi's government in India. The overview in health I would like to speak is health and wellness has been a key focus over the Narendra Modi government during the last 9.5 years. This has been the crucial factor in India emerging victorious from a global pandemic by administrating over 220 crore doses of vaccines as well as exporting a significant number of vaccines to the world in the time of need. Accessible and affordable quality healthcare, a priority for the government, has tuned into a reality for the citizens of India. Previously, medical expenditure used to be severe economic burden for low-income households and often led to the debt traps. In 2018, the Modi government launched Ayushman Bharat, Pradhan Mantri Jan Aushadhi Yojana, the world's largest health insurance program. This giving permanent relief from the burden to nearly 22 crore beneficiaries. Further, the Ayushman Bharat digital mission is realizing the vision of building a digitally connected healthcare ecosystem. Over 25 crore health records of individuals has been linked to Ayushman Bharat health accounts. The digitally available health records will enable the ABHA holders to available paperless health services across the ABDM network. The government's telemedicine program, eSanjeevani, is bringing a revolution in the health sector of the country. More than 10 crores beneficiaries have been able to access quality healthcare at their doorstep, thus bridging the urban-rural barrier into the provision of specialist medical care. Over 9,000 Jan Aushadhi Kendras located in more than 700 districts are providing quality generic medicine at affordable prices to all. The government has been committed to avoiding any suffering from vaccine preventable diseases. In this regards, under various phases of Mission Indradhanush, 4.45 crore children and 1.2 crore pregnant women have been vaccinated against 12 diseases. Due to this targeted government initiative, there has been a significant decline in maternal mortality rate in the country from 130 in 2014 to 97 per lakh live births in 2018 to 20. The Modi government has brought a crucial turnaround in medical education. Few government colleges, high fees in private medical college, and massive corruption in seat allocation had severely limited opportunities for medical education. In the last 9 years, the Modi government has established new aims in several states and large number of new medical colleges. These include the first ever aims in the northeast in Assam. Further, the government holds decision to replace the Medical Council of India with National Medical Council and has ended corruption in medical education. In New India, talented students from humble backgrounds can also fulfill their dream in becoming a doctor. India's quick and effective response to the COVID-19 pandemic was supported by its rollout of the world's largest vaccination drive, and that too using indigenously developed vaccines. In a landmark shift from past when the citizens had to wait for decades to start of vaccine drives, PM Modi-led government ensured administration of more than 2.2 billion doses of COVID vaccine in a short span of 2 years. In the last 9 years, India has made huge strides in healthcare. A government that invests in healthcare invests in its people, and thus the Narendra Modi-led government has truly been a government of the people, for the people, and by the people. At a glance, we can have a few statistics like 4.54 crore hospitals under Ayushman Bharat, 1.59 lakh Ayushman Bharat health and wellness centers, more than 9,000 Jan Aushadhi Kendras, Mission Indradhanush, more than 5 crore people, mothers and children protected, 15 new aims and 225 medical colleges being added, 3 crore citizens purchased affordable medicines from Amrit pharmacies, 220 crore COVID vaccine doses administered, 37 crore Ayushman Bharat health accounts created, 23,000 crore saved under Jan Aushadhi Kendra, 69,000 medical seats added since 2014, 1,500 plus PSA sanctioned by the central government. PSA is the plant where has oxygen is being created. 15 crore telecommunications through HWCs, health and wellness centers. The few points which we can think about is ahead of the curve due to proactive leadership at a time when many world leaders failed to recognize COVID-19 as a threat. Even before India had a single case, screening began in India in all the airports. Long before many other countries took it seriously, in the first week of March 2020, PM Modi said he would avoid gatherings and such as Holi Milan and set an example. Mass mandates were erected in large parts of the India before the WHO called for them. At a time when many countries were only thinking of massive mortalities, in April 2020, India has already set up vaccine task force to save lives. India started using rapid antigen tests to speed up testing long before WHO recommended it. The fact that India went into early lockdown has been universally acknowledged. This helped ramp up medical infra. Future proofing India with Pradhan Mantri Ayushman Bharat Health Infrastructure invest rupees 64 crore on health infra, support from 17,000 rural health and wellness centers in 10 high focus states, establishing more than 11,000 urban health and wellness centers in all the states, more than 3,000 public health units in 11 high focus states, setting up integrated public health labs in all the districts, establishing critical care hospital blocks in all the districts with a population of more than 5 lakh. Digital in the way. With the success of COVID and Arogya Setu, the power to tech in healthcare that has been seen. Ayushman Bharat Digital Health Mission is creating a seamless online platform for the healthcare. Citizens create their Aadhaar numbers in which their digital health records are linked. With the citizens' consent, the data can be accessed by healthcare professionals. ABDM facilitates evidence-based decision-making for effective healthcare interventions. 37 crore Aadhaar have been created so far. The speed at which India's COVID-19 vaccines were developed shows a new India that does not have to wait decades for vaccines or depend on the other countries. Up till now, any vaccines which were brought in India took decades, but COVID-19 vaccine, it just took the introduction of COVID-19 vaccine in India just took a month. So this is a record and we are all proud of it. The milestones are to prevent diseases mission Indradhanush, over 5,000 pregnant women, 5 crore pregnant women and children immunized under Ayush and Yoga. For primary care, Ayushman Bharat Healthcare and Wellness Centers, 1.5 lakh HWCs, hypertension screening is more than 35 crore, diabetic screening is more than 30 crore, and teleconsultations are more than 15 crore. For secondary and tertiary care, Ayushman Bharat health cover of rupees 5 lakh. Ayushman cards up till now given are 23 crores. Hospital admissions 4.5 crore and treatment worth rupees 54,000 crores. For medicines, Jan Aushadhi Kendras, there are more than 9,000 Kendras which sell medicine at lower prices. Approximately over 23,000 crores saved from citizens in last 9 years. Historic ramping up the infrastructure to fight COVID-19. Testing labs in in March 2020 were only 14 labs, but now there are 3,390 labs. In March 2020, domestic manufacturing of PPE kit was zero, but now we can manufacture in one day 20 lakhs PPE kit. In ICU beds in March 20 were around 2,000, but now they are more than 1 lakh. Oxygen supported beds in March 2020 were only 50,000, but now we have 5 lakhs oxygen supporting beds. In innovative solutions, improved COVID management, like oxygen express trains, close to 900 oxygen express trains delivered more than 36,000 tons of liquid oxygen. Air Force deployed for transportation of cryogenic tankers. Isolation coaches. Railways converted into coaches in quarantine and isolation facilities. Makeshift facilities. Paramilitary forces and central agencies operated makeshift quarantine facilities. PSA plants, 1500 plus PSA plants sanctioned by the central government. The PSA plants is the plant where government manufactures oxygen for the patients. The vaccination in India, days taken to vaccine 100 crore people were 279. Days taken to vaccine 150 crore were 348 days. 358 days. Days taken to vaccine 200 crore was 548 days. Isn't this a record? 548 days. We vaccine 200 crore people. So this was a great achievement in 9.5 years by the Modi government. I would really like to thank and congratulate our Honorable Prime Minister Shri Narendra Modi ji and our Honorable Union Minister Shri Amit Shah ji and our Honorable Bharatiya Janata Party National President Shri JP Nadda ji for getting the revolutionary change in the field of medicine and health. I would also like to congratulate and thank our respected Deputy Chief Minister Shri Devendra Fadnavis ji, our respected Bharatiya Janata Party Maharashtra President Shri Chandrasekhar Bawankule ji, and Bharatiya Janata Party Mumbai President Ashish Shelar ji. Respected North Mumbai Member Parliament Shri Gopal Shetty ji, under whose guidance I have been working since last 8 years. In North Mumbai, we have been given Ayushman Bharat cards to thousands of people, and myself, I'm working on ground to help people to enroll them. When people come to me, I take them to different government hospitals and get the knee replacements done under Ayushman Bharat, and different surgeries like fractures to be done under Ayushman Bharat. One we have got it done in Shatabdi Hospital, the other we have done in KM Hospital. So there have been many beneficiaries. See, getting card is very important, but at the same time, it is more important that these card holders, they get the benefit at the needed time. When there is an emergency, they get the benefit of these Ayushman Bharat cards. So we have to work on ground for such things so that the government can also make such good benefits. I would also like to thank MLA of Borivali Shri Sunil Rane ji and respected North Mumbai President Shri Ganesh Kankar ji. Please like, share and comment on my YouTube channel, and please stay tuned. Thank you.